Perfect. Please, guys, do let me know if the fact that I have muted my Facebook, please do let me know if you can see us and if you can hear us very clearly. Otherwise, karibuni sana to our Ask the Life Coach Fridays. Victoria, karibu sana. Ashu wangu, karibu sana. Kindly do let me know in the chat box if you can hear me clearly, because let me see. Reverend, just give me a minute. I make sure all is well on this other end of Facebook. All is well on this other end. Yes, perfect. Perfect, perfect, perfect. We can get started. Karibu sana. Today, I have the pleasure of hosting Reverend Kivangula, who is a reverend, let me start with that, a counseling psychologist, a lecturer, the sitting counselor for the university for KEMU, and of course, a mental health specialist. And karibu sana. Today, we are so excited to have you on board. And the thing that, in fact, I should have added, the reason why I am super excited is because I remember when we were having this conversation, and you mentioned that you have over 40 years experience in this field. I was blown away. I was very excited because I thought, what an amazing, amazing opportunity to just sit and learn from someone who has worked in this field, someone with a wealth of experience. And for that, we are so excited to have you on this session. Karibu sana. Please feel free to introduce yourself.
Thank you so much, Alice. My name is what you have mentioned, Reverend Gregory Kivangula. The last name is Zioka.
Okay.
That is my surname, and I'm glad to be part of this conversation. This is something that I am very passionate about, something that I have done for so many years, and especially as we witness the rise and the upsurge in mental health care, not just in but world over. This is an area that needs to be given a lot of attention.
Yeah.
And I pray and wish that the government can invest more resources to help people that are struggling with mental health issues.
Yeah.
Thank you so much.
Karibu sana. And as you're mentioning that, in fact, before we went on live, I was asking this question: what have you been able to witness and see over this period of time being in this space? Because I was sharing earlier of how I grew up, and my God, the things that I saw and how we used to laugh at people who are mentally ill. And I was thinking, it's not because we did that out of Madarao, it was because that is what we grew up. That is what the people around us were doing. In fact, anyone who was thought to be mentally ill was segregated. They were stigmatized. No one wanted to associate with them. And growing up, we're kind of like doing the same thing. And I was sharing, it's not because we want to do that, but it's because of social conditioning. Even though tumeona, we don't know any better. And my question would be, have you seen any changes in how people are approaching, our mental health wellness over this period of time?
Thank you so much, Alice. One thing that I must say, which is very sad, that a lot of people do not still understand what the illness is all about.
Yes.
We have a lot of misconceptions, a lot of myths, and no wonder we stigmatize and discriminate people that are suffering from mental health issues.
Yes.
Many, many years ago, to be specific, in 1983, I conducted a study, a countrywide study, to determine the attitudes and the perceptions of practicing occupational therapists towards the mentally ill. Now, occupational therapists are people that are trained in, among other things, in mental health.
Okay.
So I conducted this study across the country, and it was very shocking that I found among quite a number of the occupational therapists who responded to the questions said that mental illness was as a result of witchcraft, or some others said that somebody was cursed, or something like that. And I'm afraid that we still witness the same misconceptions today. Others even say that if you're mentally sick, then you have demons. And speaking from a pastor's standpoint, I can say it is very sad that the church has contributed in making the life of the mentally ill sick, that if you have mental illness, it is possible you have demons. The truth of the matter is that people do not understand what mental illness is, and many people do not understand what causes mental illness, because there are various reasons why somebody might develop mental illness. Some of them are biological reasons, explanations. Some of them are hereditary explanations. Some of them are, environmental explanations, and so forth and so on. For example, if somebody loses a job today, and that job was their only hope, that person is likely to experience one or another type of mental illness. To give an example, like depression, or even suffer from some anxiety disorder, all right? And so to generalize and to say people are suffering from mental illness because they have demons or they have spirits. But I will also be quick to say, I am not saying that demons and the spirits are not there. Yes, they are there. And I speak now from my pastor's perspective. But for you to be able
I don't know what has happened. Reverend, it's like you have hung, hang. I don't know whether you can hear me on this end. Kindly let me know if you can hear me. Because I don't know what has happened. You have just frozen and I cannot hear you, but everything was going well before that. Okay, it looks like maybe there's an issue with his network. So we shall give Reverend Gregory Kivangula just a few minutes to know whether he can be able to jump back to the conversation. And as we are doing that, please allow me to check the comments and see what we have. Thank you for your response, Kwame, that we are loud and clear and that the echo is sorted. Asante sana. Then Jennifer, thank you so much for joining in. Guys, please share your questions. Please share your comments. Please share your observations when it comes to mental wellness, mental well-being, mental illnesses. Please share that as we wait for Reverend to join us, Nona Anna to join. So shortly we'll be going back to the conversation. And thank you so much. Thank you so much for your comments. And I appreciate you guys for taking the time to join us. We can see you now. I can see he's connecting to the audio, so let's give him a few minutes. Can you hear me?
Yes, sorry, my power went off.
Oh, pole sana. We are glad to have you back.
So I have turned to my mobile phone.
Ni sawa, iko sawa kabisa. Thank you so much.
So I was using Wi-Fi. Now I am using data.
Oh, all right.
Mobile data.
Okay, thank you. Thank you for being able to jump back so fast. And karibu tena.
So what I was saying, is that the reason there is so much misunderstanding about mental illness is that people do not have information.
Yeah.
And I was saying, in as much as we know that there are demons and there are spirits, one is to be knowledgeable, to be able to distinguish between, what is demonic and what is sickness. Yeah. And I can say there are not many people who can do that unless you have training.
Yeah.
I have training in psychology, I have training in mental health, but I also have training in theology. So I'm able to look at a person and I can be able to say, this person is likely to be sick, or this person is likely to have a spiritual problem. But to jump around and say that because somebody is having depression, they must have committed some sin, that is to be ignorant. And I think that is one of the challenges that we are facing with regard to fighting mental health issues in our country and in the world over.
Wow.
Yes.
And thank you for so much for saying that, because one thing that we really have to come to understand is what you've said. And I really hope we can get to a point where even for the people who are serving in church, get to have training in psychology and a bit of mental health, like you're saying, so that someone can be able to tell, do we have a spiritual problem here? Or does this person need prayers? Then akitoka hapa, they need to see a psychologist, they need to see a psychiatrist, they need to see, a counselor. Sometimes my friends and I make these jokes, yeah? And when someone is, we can say, I call it bypassing. They have an issue, but they want to cover it with prayers. Oh, I'm having a challenge at home. My husband and I are really in bad terms because of, and you can tell this is something that really needs to be addressed. But what they're saying is they're fasting about it. And I remember my friends and I joke and we say, you know what, we understand you need Jesus, but you also need to see Jesus. You also need Jesus and a therapist too. There is nothing wrong with having Jesus and a therapist. And I really, really love, because that's the same thing that you're saying, that we really need to get to a point where we can be able to tell, these prayers will actually do. Then this one, to have prayers, we are not refusing, they're very important. But on top of that, we need to get, guidance from a professional to help us sort this issue. And just speaking on anxiety and depression, which was our topic for today, yeah? For most of us, we don't even really understand what the difference is. So I'd love for you to just shed some light on this particular two mental conditions. What is anxiety? What is depression? And how can I even tell if maybe I'm suffering from either, or there's someone around me going through that?
Thank you so much, Alice. And I'll try as much as possible because the information is so much. Okay. But I'll try and summarize. Now, let me begin with the depression. It has been said that depression is the common cold in mental health. Oh, wow. Or in mental illness. Okay. Which means every single one of us catches that cold called depression. And having said that, it doesn't mean that when somebody has feelings of depression, it doesn't mean that they have a psychiatric problem. Okay. For example, if I may use an example of a young man who came to see me because he had been abandoned by his girlfriend and he attempted suicide because he felt he had come to the end of the road. Now, and I could understand that this young man has reached a point where he doesn't see any other option out of the situation other than committing suicide. So when we are feeling fed up, miserable, sad, and this lingers for a long time, then it is very likely that we are suffering from something we call depression.
Okay.
This oppression or this kind of feeling is very common. Actually, almost every one of us, children as well as adults, will experience some measure of depression at some point in our lives. In fact, it is recorded that 5 to 6% of the general population is likely to have a depressive disorder during the course of our lives. Now, let me pause there. So when I look down on people that have mental health issues, and I discriminate them and I stigmatize them, all that is happening is that I am not aware I could be the next candidate in experiencing what that other person is experiencing. You never know when it happens, because you could be loving at somebody and today your marriage breaks and you are down, or your child does something that is heartbreaking and you are discouraged. So depression is very common. It affects people of all races, people of all religious backgrounds. Depression knows no boundaries. It affects the rich, the poor, the fat, the thin, the religious, the non-religious, every one of us. So what is depression? It is that persistent, and I want to underline that word persistent, because if I feel discouraged because I have failed an exam, that doesn't mean that I'm mentally sick. That's why I want to qualify for us to say it is mental illness.
Okay.
Qualify by saying it is that persistent. In other words, it lingers for some time, feeling of sadness or unhappiness most of the time. And it may be accompanied by other, symptoms like feeling helpless, hopeless, and so forth and so on. And then alongside those feelings, you will have the person losing interest in life, losing interest in work, losing interest in association with other people. They may also have problem concentrating. If you are a worker, you're working in an office, you cannot concentrate on tasks that you've been performing. Sometimes you may have difficulties remembering. Those are what we call the cognitive dimensions of somebody who is experiencing depression. Your memory may be affected, and you may not be able to cope with things that you were used to before. Sometimes feeling utterly tired. You wake up in the morning and you hear people talking about waking up with the morning blues. That is actually an indication that this person will be going through some kind of depression, feeling exhausted, without energy, and the feeling, like you are slowed down. And sometimes you may feel restless and agitated. You may lose appetite, you may lose weight, or you may add weight. Now, the interesting thing about depression is that some of these symptoms will, manifest in one extreme or the other. For example, with regard to appetite, some people may have increased appetite, or others may lose appetite altogether. Yeah. Okay. So when you find somebody all of a sudden overeating, somebody who has not been overeating, and all of a sudden they're overeating, check. There is a possibility that that person could be going through some psychological stuff. Lots of interest in sex for those that are married. Lots of self-confidence, the low self-esteem that a person feels, feeling like you're a nobody, feeling useless, inadequate, hopeless, pessimistic. You don't see like anything is going to work in your life. And then, of course, you want to avoid other people. Yeah. You keep away from people. And those are very serious indications that one would be going through depression. I talked about feelings of hopelessness, and this is where people may start feeling that it is not worthy living. And then they start experiencing feelings of self-destruction. he started having suicidal feelings and so forth. And then, although I am not exhausting all these manifestations of depression, sometimes depression may manifest with the physical symptoms like headache. And I'm not talking about your headache, Alice. Like, you know, headache that seems not to go away, even after taking, you know, painkillers and so forth. One may experience chronic pain for which they have no explanation. Digestive problems, either you are experiencing constipation or you may even be diarrheaing and there is no bacterial or viral explanation as to your diarrhea. Now, all those plus many others could be an indication that one could be going through depression. And finally, people who are depressed also tend to suffer from anxiety and many other mental illnesses. That's what we call in mental health comorbidity, where one psychological problem coexists with another. For example, somebody who is experiencing depression may actually become a substance abuser. So you have depression and you get into substance abuse. So you suffer from substance abuse disorder. That's what we call comorbidity, where two conditions or situations coexist in one particular person.
Okay.
Now,
I have a question.
Go ahead and yes, go ahead.
And my question is, as you are sharing the symptoms, someone close to me came to mind, someone that I know. And I was thinking about how this person behaves when they don't have money. They're very, when they're going through a phase, yenye hawana pesa, like almost all the things that you've spoken about, they have that symptom. They have those symptoms. They complain of headaches. They are very irritable. They don't want to join people in their social, in social gatherings. And then they're very mean, by the way, because they're usually very nice people. And then on top of that, oh, Harisha, by the way, like all the time, as in, and I'm wondering, so could this person be depressed? But akipata pesa, hizo symptoms zote zinaisha.
Yes. Yes and no. This part may be depressed, but you know, psychological challenges, including anxiety. And let me say, a layman's way of looking at depression is to say that depression is.
Sorry, you have hung a bit. We didn't hear that part. I hope he is not dropping off again. Let's wait and see. As we do that, let me check the comments. And thank you for the guys who have joined in. Karibuni sana. Please feel free to share your questions, your comments, your feedback. Zote, please feel free to share that. Thank you, John. Thank you, Young Kirubi. I think maybe his Wi-Fi is back, So let's give him a few minutes like we had earlier, and then he's going to come back on, As we do that, let me just do the same thing. Let me go through the comments. And oh, there we have it. He's coming back. Thank you, John. Thank you, Young Kirubi. Ashiwango, I see you. Thank you guys for joining in this conversation. And let's just give Reverend a few minutes to join us. And we look forward to the questions and the feedback that he's going to share with us. Reverend, please let me know if you can hear me.
Yes, I can hear you. Sorry, I have network issues.
Okay. Should I remove the two other gadgets that you've joined with?
Yes, you can remove the mobile phone. I am back to my iPad.
Okay, then let me do that.
My power has come back.
Hallelujah. We are happy that it has come back. So I should remove the 005 as well. You're using the iPad, right?
Yes,
Perfect.
I'm using.
Yes, you are giving us the answer to, understanding the answer you had given was yes and no, and you're talking about a layman's understanding of depression.
I was saying, for example, that person who is
And
broke.
we are not seeing you. Please put on your camera kindly. Bado hujafungua camera.
Okay, I'm trying to.
Okay, all right.
It is muted.
Oh, let me see on this end.
I can see my camera is muted.
Let me see whether I'm the one who's done this from.
Yes. Tuko watatu.
Oh, this is so funny. I think your family has joined. Let me remove them.
Who has joined?
I am seeing Karason and Sharon.
All right.
And I am trying to remove them and I'm unable to. I don't know whether they can be able to just drop from their end.
Now you can see my picture now.
Yes. Kabisa,
yes.
You're very clear. Yeah. Please continue. You are giving us the...
So what I was saying...
Yes.
A layman's way of explaining depression, one way of explaining depression in layman's terms, is the experience of loss that turns inwards.
Okay.
Like this person who had money.
Yes.
And broke. Okay. And because they are broke, in their mind, they start interpreting lack of money to mean like there's something missing in their lives.
Yes.
So they feel discouraged. So it's like a loss which has been converted and turned inwards, and then it makes the person feel like there's something missing in their lives.
Yeah.
They are feeling miserable, they are feeling helpless, and so forth and so on. And please take note of what I have said. You are broke, but in your mind, you conceive it that not having money interprets or translates into me not being the real me that I should be. Okay. I hope you're getting it.
Yes, yes.
So that's one of the explanations behind the cause of depression. Cognitive explanation relating to depression. Okay?
But let me ask, yeah, because that is very common, because especially for men, yeah, because the way society has become nowadays, it's like men, a man's worth is almost being tied to how much they can provide. So that if this man has the ability to provide has been reduced or has been cut off, maybe biashara imeanguka or they've lost their job, it is very easy for this person to actually have that picture in their mind that, they're not worth it or they don't deserve it. And it's very easy for them, especially men, it's very easy for them to get depressed, so to speak. So I'm wondering how can this be addressed, having in mind that, my goodness, nowadays relationships have almost become transactional. I was having a conversation with a friend regarding the same topic, mental health, and the guy was mentioning, even at home as wives, we are not helping the situation, because someone can tell mzee lose kazi, but they're still putting pressure. And I was trying to just explain where we are coming from as women, as like, fine, I understand mzee may lose job, But imagine lazima watoto wakule. So I don't know, where can the balance be so that the man does not, I have two questions. Number one, how can especially men work on this particular statement that you have talked about, that, you know what, having a loss of income at this point does not have to relate with it being, you know, you telling yourself in your mind that sasa imeisha, it's normal and this is it. Please, let's start with that one.
Okay, that's a very interesting one. And that is one of my favorite or pet subjects. The question that I like asking people, what defines you as a person? What determines your worth? What determines your significance?
But society has told us, mwanaume ni wallet.
Does money define a man? The answer is no. That is what we call erroneous thinking. And that's why in counseling, there is something we call cognitive restructuring. So what I do is that I help you, Alice, to reorganize the way you think. For example, Kivangula is not defined by the degrees he has. Kivangula is not defined by the money he has. Kivangula is a human being with a worth that is inherent in him, with or without money.
Yeah.
In other words, I can say I am significant and I am secure, not because I have money, although it's good to have money. I wish I can be a billionaire. But even being a billionaire does not define me. Did you know world over, a lot of billionaires commit suicide?
Yeah. And
they
famous
get all
people.
But the money does not translate to peace and joy.
Yeah.
Because peace and joy and the contentment do not come from material things. Those are gifts we are given by the Creator. All right? And so the reason we get depressed is because we have this disorganized way of thinking that we think, you know, that if I am married, and I'm not saying marrying is bad, that if I am married, all my problems will end.
Yeah.
The opposite is true. You get married and you get yourself into another, terrain, which can be very tough, to go through. All right.
Yeah.
And so just the way we think could be part of the reason why we are having so many psychological problems today.
Yeah.
And so we need to reorder our thinking. And you remember, Solomon, many thousands of years ago, wrote and said, for as a man thinks, so is he.
Yeah.
So if you think negative, what happens? You start experiencing a lot of negative things in your life.
Yeah.
Negative, lack of peace and so forth. But if you think positive things, and I like what the Apostle Paul says, whatever things are true, whatever things are trustworthy, whatever things are good report, think about these things. It is not bad to think about prospering. Prosperity is not bad, in fact. In fact, God desires that we prosper, and it is there in the scripture. But it does not define who we are. Because the moment we peg our worth on things, we tread on dangerous ground, because when those things are no longer there, then we crash.
Yeah.
And we are depressed, and we can even commit suicide.
Yeah.
But let me explain what anxiety is, because I can see time is running. Now, when we are talking about anxiety, we're talking about excessive fear and worry. Excessive. The word excessive is key. In other words, ordinary, general worrying, like for example, worrying that your flight might be late and so forth, that is normal.
Okay.
But we are talking about if it becomes a pattern of life and it is persistent, then it borders on what we call anxiety. Now, talking about fear, fear is the emotional response to real or perceived danger or threat. That's what we call fear. Okay? All fear is not negative. All fear is not, psychologically bad.
Yes.
Because if you see a lion and you change route, that fear is good fear because, your adrenaline is set to prepare you to flee from danger.
It will
So
save
fear
you.
is not bad.
Yes.
But when fear becomes excessive, it becomes a pattern of life, then we begin to talk about mental health issues. Now, anxiety is basically the anticipation of future threat. You're anxious that things may not turn out the way you want. Now, fear and anxiety sometimes overlap, but they are not always the same. Fear is more associated with, that arousal we get in our bodies to fight or to flee. Like I have already given an example. When you sense danger and you want to flee, okay? That is what we would call fear. But anxiety is more associated with the muscle tension and the vigilance in preparation of imminent danger that may be real or imagined. You need to know that a lot of us who suffer from anxiety, that anxiety may be related to imaginary things. And unfortunately, a lot of people who suffer from anxiety disorder is because of imaginary things. For example, people that fear being in closed places, or people that will fear to fly in an aeroplane, not because they had an air crash experience, but it's a fear that gripped them from wherever it came, that then will border on what we are referring to as anxiety disorder. Related to and anxiety is something we call panic, which is also very common among people who experience anxiety. Now, a worried and anxious person may know what it is they are worried about. Now, listen to this. You may know what you're worried about, but you cannot put a finger on what you are anxious about. And that's why I said a lot of what we call anxiety is something that is based on imaginary things we cannot explain. But when we are worried, we can say, I am worried that I may fail this exam. I am worried that my child may not do well in school. I'm worried that this disease may get worse. That is what we call object worry or object fear. But anxiety is that you cannot sometimes explain why you are anxious. And that's why a lot of anxious people tend to have many physical symptoms like sweating, increased heart rate, shortness of breath, dizziness. I'm just mentioning some of them. And they might think that they're actually suffering from a medical condition or a physical condition, which now increases their anxiety, And what do? They might start taking medication so that they can sleep because they are not able to sleep, Or they might start saying they are suffering from some malaria, or they might say maybe it's typhoid, and they start taking, those kind of things. Or they may, if they don't get better, they worry more and more, And they may spend a lot of their resources in order to get this cure. Now, when all these things, like we talked about depression, are brought together, then the person may get to a place where they might need professional intervention by a psychiatrist or a medical doctor who is specialized in treating mental illnesses.
I have a question. Before I get, let's say I'm the one who is maybe struggling with anxiety, yeah. Before I even need, before I get to the point where I am figuring I need to seek help, I have just noted that sometimes I get into a panic, my mind just goes blank, I start sweating, and that's because I'm feeling like I don't have it together. Like you mentioned, I want to be in control of the future, but I'm not, and I feel like I'm sinking in this hole, and my goodness, it's like there is no end. I'm just sinking into darkness. What can I do?
There are many things you can do.
Okay.
The simplest, you can talk to a friend.
All right.
Just by merely opening up to somebody, ventilating what you are going through, can actually give you temporary relief.
Okay.
Or you can talk to a health professional. Even before you think about a psychiatrist, you can talk to, a nurse, or you can talk to a general practitioner, say, I'm going through this. And, so that you are sure that what you're feeling does not deteriorate and get worse. You can even talk to a pastor, all right? Now, in my pastoral work, I have come across numerous people, and I have counseled numerous people. I cannot even count. And some of them will come with something that actually looks clinical. You know what I mean, clinical? It looks like they have actually moved to the point of disorder, mental breakdown. But when I listen to them, I seek to understand them. And then together we try to explore what they are going through and what it could be meaning. Those people kind of get relaxed and they get relief.
Okay.
I remember one time a lady that was referred to me, in fact, she was brought to me by the sister. This lady had sleepless nights, I don't know how many. And I did not do any dramatic miracle of deliverance. I just sat down and was available to listen to this lady. And I said, Mama, how can I be of help to you? That was the question I asked. And she narrated this long story about, the things that she was struggling with in her life. What was I doing? I was there listening, and affirming what she was saying. And at the end, I said, I hear what you're saying. I may not understand what you are going through, but I want to assure you, I am here to stand with you. Just mark that. I am here to stand with you and to support you in any way I can. And then we had a short prayer. That night, it slept, and the sister called me and asked me the following day, what did you give to my sister? I said, nothing. I was just there to give her support and to just show her that even though she was going through the stuff she was going through, there were people that were available and, willing to walk with her in this journey. So some of those cases might be cases that might need something as simple as that. And I also want to be quick to say, all people who suffer from anxiety and depression do not respond to care in the same way.
Okay.
There are some who will respond to a situation like what I did with that particular person. There are others for whom that may not help. Okay. And that's why I want to go back and say knowledge is of essence here. You need to have sufficient knowledge to be able to say, I think this is bordering on the clinical. And I think this person may need some clinical assessment by a specialist. Okay. So I don't know whether I have answered your question.
Yes, you have. You have answered that. And you've even answered, I think, the next question, which I was going to ask, which was if not, the case has been turned around and it's not me who is struggling, but I have a family member who is struggling. How do I speak to them? Because most of the time we don't know what to say. we usually say, usijali, you know, things are hard, or get over it, or man up, or I've had it worse, or you're too soft. But I think you've answered a very huge part of that, of how we can, you know, talk to people around us. And what I've picked from you is, if we have someone who is struggling, the idea is not even to stand in as a solution giver, but
Yes.
as a person who is giving a listening ear. What the
Yes.
other person, the person who's going through something, what they need to hear is, I hear you and I am here and I will walk with you. We'll figure it out together. As in, you're not alone in this. That's what I'm hearing you say.
When I practiced at the Madare Hospital many years ago, we used to have group therapy sessions.
Okay.
And I can tell you, listeners, in those group therapy sessions, you know, you bring in a mix of patients suffering from different things. In those group therapy sessions, we would get together some patients with psychotic illnesses, others with anxiety disorders, others with substance abuse issues. And then you would have others who looked, you know, like they were almost recovering.
Okay.
Now, what I noticed in those group sessions is that that patient who felt downtrodden by their symptoms and by their disease, when they saw another patient shining and, you know, feeling good, they used to kind of get boosted, you know,
wow.
something to push, you know, because my friend, you know, it seems like elated. They are very happy about their lives. I need to find out what, you know, used to happen to them. I also want to give another example. One time I worked in a hospital where I used to bring together parents and the children with the various types of disabilities. And so in that group, I had a child with the cerebral palsy, I had a child with the poliomyelitis, I had a child with the muscular dystrophy, and we used to sit together in a group. Now, and I miss those occasions where parents would come and share their experiences. You know what that used to do? That parent who felt discouraged, who felt like their child, the situation was hopeless, they kind of used to leave that hospital session feeling, you know, excited. Oh yeah, if they have managed to get where they are today, if I can see this improvement in so-and-so's child, I don't think mine is an exception. It is the same with the mental health, you know, practice. That even if you don't put them in a therapy group in a hospital setting, community support groups are very, very useful. Church support groups, yeah? Church support groups are very, very, very useful. Family support groups are what these people need because they are struggling with their life. They don't need to be condemned. They need to be supported. They need to be encouraged. And that is the essence. That is the secret behind success in mental health. Working together to support those that are experiencing mental health issues, you know, working with them and seeking to understand what they are going through without condemning them.
Okay. Let's see if we have any questions from the audience. We don't have a question, but we have comments. There is a monkey who's saying this is very nice teaching. So thank you so much for sharing this information with us. Then Jenny is saying this is brilliant, Rev. Rev is explaining so well to our level, which I totally agree with her. You're breaking it down to, you know, what we can be able to understand as laymen. So thank you so much. And there's something that you've mentioned that has taken me back, I don't know, like almost 25 years ago. I remember I was 14 years and my mom's sister was unwell. So she was taken to Madare. And I remember my mom mentioned, okay, let's go visit your auntie. So first of all, I remember I was in Form 1. I was so scared because Madare did not have a nice reputation, so to speak, from the people around. Every time you'd hear, they'd either whisper the term Madare or they'd laugh. And it wasn't a nice laughter. It was the one for, please, you do not want anything to do with that. And then I remember we went for that visit, my mom, my sister, and I. And I can still recall, yani, it was almost like visiting a prison, yeah? Like all the gates were closed, everyone was being treated like, I remember the patients were being treated like prisoners, and some were almost being mistreated, wanavutwa, and I still remember that memory I have in my head. And when we were leaving, I was almost scared. I was thinking, what if they mistook me to be a patient? Then I'd be locked up here, because people are trying to speak when were cut off, yeah. And even, I don't know, it was just a very nasty experience, so to speak. And it stuck in my head for, I think, a week or two. I was traumatized, so to speak. But there I was a traumatized, and I was a visitor. Now, as we are having this conversation, I'm just wondering, how is it with the patients? Has anything changed? You know, has the reputation of the mental hospital changed over time?
That's a very interesting question and a very good question. Let me say, we still are a long way to go in as far as overcoming stigma and discrimination is concerned. And I want to say, in Europe and in America, in the 19th century, they had the same problem. In fact, history has it that the mentally ill were locked in asylums. They were not even called hospitals. They were called asylums, some kind of prisons, and they were chained and beaten, to drive the demons and the hell out of their life. Until there came people like, the likes of that Quaker bishop or pastor in England called Thomas Tuke, who said, no, mentally ill people are human beings like anybody else. And so he, together with others, now started organizing what was known for the first time as humane treatment for the mentally ill. And they came up with hospitals, and the mentally ill were now given decent treatment. But I want to say, in developing countries, we are still a long way to go. I think in Kenya we have tried, because I see a lot of improvement in hospitals like Mathare or in other hospitals where there are units for the mentally ill. I think we are trying, but where we have a challenge is in overcoming societal attitudes and the prejudices towards the mentally ill. That's why we need to do a lot of education. We need to do a lot of campaigns. We need to do a lot of advocacy, just like we have done advocacy for HIV/AIDS, just as we have done advocacy for malaria and so forth and so on. We need to do the same for mental illness. And that's why I was saying, I pray and I wish that the Minister of Health, on top of what they are doing, whether they can commit more efforts, more resources, so that we can educate the community and create awareness that people who suffer from mental illness are people like anybody. And the bottom line is that any one of us can suffer mental illness. There isn't any single one of us who is exempt from suffering mental illness. I know people, friends of mine, who broke down, very decent people. They broke down, because of one reason or another. Because again, I said, if we understand what mental illness is, you remember I said mental illness can either be hereditary, it can come because of hereditary, issues, it can be biological, it can be an environment. There can be as many causes of mental illness. It can even be caused by abuse of drugs, alcohol, and other substances could also lead to some type of mental illness. But we do not need to add more pain to those who are already suffering with the mental illness. We need to support, because They are our brothers and sisters. They are our neighbors. Let us be neighborly, like that good Samaritan. Let us be neighborly to people that are suffering and living with mental illness.
I love that. And as we are almost coming to a close, yeah, you mentioned the church, and being a reverend, I feel this is a very important question to ask. Yeah. So I am here with my children. Maybe one of my kids is really giving me a hard time. I have been really believing and trusting that, and praying that it will be sorted. At what point do I, as an individual, realize, okay, fine, as much as I'm praying, I also need to seek help, especially coming to ninakuja kuomba na pastor. Mtoto wangu, by the way, ame withdraw, haongei, anashindanga kwa room, they don't talk to anyone. Father, please, pastor, let's pray for my child. So at what point do you encourage your congregants to say, okay, fine, let's pray, but yes, I also advise you to take your child, to seek professional services? That's one question. The other question is, like you had mentioned earlier when we were just starting the session, the church has played a big part in creating this misunderstanding and the stigma of mental illnesses. So even with the church, what do you think is the role of the church today in undoing this stigma that we have as a society, and just just bringing this awareness of mental wellness to the congregants who are coming to church?
Let me look at the first question, address the first question.
Okay.
What point do I determine that I need to take my kin or my brother to the hospital or take them to the church? Let me say this without any fear of contradiction. When we talk matters mental health, of course, we did not have time for me to go into the classification of the symptoms, okay? Now, when we classify the symptoms, there is a category we get to that we describe as psychotic symptoms.
Maybe you can share with us, please.
So, when we talk about psychotic symptoms, we are saying this person is not only suffering from depression, but the depression has led to a point where these people are no longer in touch with reality. So when you hear the term psychotic, it means that this person is so sick that they are no longer in touch with reality. How do we know they are no longer in touch with the reality? They start hearing voices. That's what we call auditory hallucinations. They start hearing voices which the people around are not hearing. They start seeing things which nobody else is seeing. Or they say, oh, there's a snake in this room, but nobody else is seeing that.
And now, that's the point we say, riso ashindwe, pepo nyeusi shindwe.
Yeah. Now, when a person gets to that point where they start manifesting psychotic symptoms, the only route out of their situation is to refer them to a clinician. A clinician who will do thorough assessment and prescribe appropriate medication. And you know why medication is given? Because I want to talk to those who think that medicine doesn't help people with mental illnesses. What happens in some of these mental illnesses, I say some of them have a biological causative factor. So what happens is that some chemical imbalances, some disorganization of the way some of our chemicals in our bodies, like those we call, like for example, adrenaline, which all of us are familiar with. and other, neurotransmitter, in that family may, not be functioning the way they should be functioning. And that's why medication is given to normalize the way the body functions.
Okay.
Now, but can a pastor pray for a person with psychotic disorder? Now, I know that's a very sensitive one. This is my answer. For you to pray, when you know somebody has a psychotic condition, you must have clearly heard from the Holy Spirit that this is the right thing for you to do, and that when you do it, they will actually be healed. If that person is not healed, then you have not heard from the Holy Spirit. And I am sorry for many of my colleagues who think that you can pray for any condition. When Jesus prayed for people that were lunatic, as they were called those days, he did not pray twice. He simply, commanded that spirit to come out of the person. Now, and then I want to add and say, there are people among Christian workers and the clergy who are gifted in this specific area of ministry. I'm afraid not every preacher and not every Christian is gifted. This is what we call a specialized area of ministry. And what is the proof that you are gifted is that you pray and it happens. Otherwise, I recommend that if you have somebody who has reached that level, take them to the hospital. Continue to pray while they are being treated. Now, the second question was, can you refresh me?
The second question was, what role can the church play today to help create more awareness when it comes to mental illnesses and conditions?
The church has a lot that we can do. I talked about support, either in prayer or in encouraging them. We also need to encourage the families of those people that are affected. And I also say, we also need to invest in the care services that are involved with the care of people with mental illnesses. Alice, it is very sad that the church in the world over has majored so much in building institutions and the monuments rather than spending a lot of our resources in uplifting the well-being of human beings. I want to see the church has come short. I look forward to a day when a church, like my church, CITAM, will one day say, we are going to set up a rehabilitation facility to support people with mental health issues. Yeah. Because our mission is not to gather every Sunday and have good time. Our mission is go ye into all the world and make disciples of all people. Now, all people includes people with mental health challenges. It includes the prostitutes. It includes even the beggars and the thieves. Those people that nobody wants to associate with. That is our mission. Our mission is to go out there. And that is why I love the story of the prodigal son. The story of the Good Samaritan story. This Samaritan was not even part of the jury, but he showed what it means to be human. So I believe the church, it is time for us to be human towards those who are suffering. I wish every church would give a tithe, a portion of their tithe towards the improvement of a hospital like Mathare Hospital. I wish the churches in Nairobi can give a 1% of their collections and say, we are going to support rehabilitation. Let's say the substance abuse, the addictions unit at Mathare Hospital, and say, we are going to provide some beds in that unit. We are going to ensure that those patients are sleeping well, they're eating well. But what are we doing? We are busy in our churches, enjoying ourselves, reaching each other instead of going out to reach the world. That's what I believe church needs to do. And the church can also participate in creating awareness in the general community about, the realities about mental health issues, and that we can stand with our own people. Can I say, I have known pastors who are broken down mentally. I have known wives of pastors who have actually broken down and developed psychotic, disorders. What am I trying to say? I am saying, even in our church, comfortable church wars, none of us can say we are exempt from experiencing what those people in Mathare Hospital are experiencing. And that is what empathy is all about. We stop and ask ourselves, what does it feel for somebody to be in that situation where that patient in Mathare is? What does it feel for that family to have a person with mental illness? How does it, how do they, navigate life with a person like that one? And society, because of those, negative attitudes from churches and Christians, that's why a lot of people lock up their mentally ill people in their homes. Some of them chain them. When I worked out in the Kiambu district, I visited many homes where we had to help, families release and chain their family members who had been chained in homes because they were told that there was no hope. We said, no, there is hope. That person can be taken to the hospital and be given medication and be supported. I wish the church, in addition to preaching the gospel, and the gospel, the gospel is not just preaching the word. It is about liberating people from poverty, liberating people from disease. When Jesus said, the Spirit of the Lord God is upon me, has appointed me to preach good news to the poor, and the outline, the things that he went to do. The church, I must say, and I am part of the church, I think we need to wake up, because one day, Alice, it is going to be asked of us. I was in your neighborhood. I suffered from depression, and you never cared to encourage me. And the king will say, go away, you workers of iniquity. I know not you. I was naked. You never gave me clothing. I was hungry. You never gave me food. I was sick. You never nursed my wounds. Go away. Your religion is empty religion. Sikujui. That is the reality that we are about to face when we stand before the judgment seat.
Oh, wow. I totally love those answers. Thank you so much. I don't even want to add anything else to that. Yeah, we have two questions here, and the first one is I'm sleeping. I guess they want to say I'm sleeping too much because of headaches. Can they be a cause of depression?
We may not be able to tell whether that headache is a cause of depression. We may want to interrogate. How did it come about? Have you had recent experiences that have made you feel discouraged and distraught? We need to interrogate. We cannot say, and that's why it is dangerous to go diagnosing people. Okay. That when somebody tells you they have a headache, then immediately you conclude they have mental illness. What I would advise that person to do, please go and see a clinician. Let them assess you. If the headache has been persistent, let them even do a scan. Because, a headache could be attributed to a number of other reasons. It could be a clot in the brain. It could be something, a tumor. It could be some vessel that is having issues. So I would say, before you can decide that it's a psychological issue, go and get yourself assessed. And we have, professionals who can assess you and give you appropriate advice. Yes.
Thank you. Very good answer. And then we have a question here from Jenny. Can anxiety lead to psychosomatic disorders? What are psychosomatic disorders? Let's even start with that.
Of course. Now, psychosomatic disorders are disorders that are psychological in origin, but they manifest in physical ways. For example, let me now go to anxiety. And I talked about it somewhere. If you have excessive anxiety, one of the things that you are likely to experience, among many other things, it is discomfort in your stomach. You might even have abdominal ulcers. And those abdominal ulcers might be directly related to your anxiety. So psychosomatic disorders are disorders that manifest in physical ways, but have a psychological cause. That's why they are called psycho. You know, somatic, soma. It's actually, it means the body, yeah? So when we talk about somatic, we are talking about the body, and the psycho is psychology. You know, the way we think and how it affects our physical function. So we have like ulcers, yeah? We have headaches. In fact, some headaches can be said to be psychosomatic in nature.
Okay.
Yeah.
Wow. So the anxiety can actually cause that.
And it does. And I did mention that. You may even have a constipation, some feeling of constipation which you cannot explain. Yeah.
Okay.
Because people that are over anxious can experience, you know, a multiplicity of symptoms, some of which will be physical in nature, like constipation, you know, ulcers, headaches, and sometimes pains in your joints.
Okay. Wow.
Yeah.
Hey, Leo, we are learning so much, and thank you so much for sharing this information with us. It is said, my people perish because of a lack of knowledge. Most of us are struggling and suffering in silence because we lack this, you know, this knowledge and information. So thank you so much. As we're coming to a close, and I'd love for you to just share with us your closing remarks. And before you do that, let me see if we have any other questions. We don't have any other questions, but I can see Teresa has said she's tuned in. Thank you so much, Teresa. Then Judy has made a comment and said, support systems is what might be our problem in this generation. And I do totally agree with her. We need to up our game when it comes to support systems. And I think you've touched on that as well. And then Mercy has said, thank you so much, and thank you for the information. Thank you guys for sharing your comments with us. So Reverend, please kindly share with us what, if we can pick something from this session that we have had today as our takeaway, what would you love for that takeaway to be? Please share with us.
The one member who has said that support systems is a missing link, I just want to echo that statement. The extended family support system has disintegrated and it is almost non-existent. Even our own children are not ready, you know, to say, you know, when dad is old and he cannot move, I'll be there for him. That is becoming a serious challenge. And with the disintegration of the extended family system and, you know, the focus on individualism and materialism, then this is where I throw a challenge to the church. If the church was sensible enough, the church is the only institution that can actually support the government to reduce or to minimize the problems that are brought about by mental illnesses in our country. But again, the church is what we have become: commercialized, institutionalized, self-centered, every church is only concerned about their own issues and so forth and so on. I wish there can come a time when churches can come together, either through organizations like the NCCK or the ACC or the Catholic Secretariat, and say, hey, come on, let us support our, members of the community who are facing mental health issues. I think it will make a big difference in our country. And so that is what I would like to echo what has been said, the need for us to stand together with those who are suffering. And who knows, it could be you tomorrow.
Yeah.
It could be somebody else tomorrow. Today I am there teaching at the Kenya Methodist University, and you meet me on the streets of Nairobi and I'm talking to myself. It could be anybody. Yeah. And I am sure every one of you saw what COVID did to all of us. We had a number of suicides that happened because of COVID and the problems COVID brought about. And those cases of suicide are very clear indications that people experienced real mental breakdown and they were not able to cope with the situation. But if society was aware of these things and we established support systems, I think we would minimize. We may not eliminate mental health issues, but we can minimize the extent, the magnitude of these problems in our country and in society. I had a privilege of working shortly in a mental health facility in one of the provinces of Canada. And I can tell you, mental health services there are advanced. And one thing that really got me excited is where they used to give parole. Parole is where you allow patients to go home.
Yeah.
They used to give parole to criminal patients. Somebody who murdered because they had mental illness, they were not jailed, they were taken to hospital. Those guys used to be given parole. Can you imagine a mandarin? He's given parole by the hospital and he goes home over the weekend. And believe you me, he comes back on Sunday.
Wow.
Now, that level of support for the mentally ill is what we are lacking in this country. That we don't even believe that mental patients can take care of themselves. The truth of is if they are supported, there are a number of them who can actually take care of themselves. And I can even, I dare say, even some of the cases we have admitted in our mental hospitals could be managed in society if we had support, family support, and community support. Some of them who don't have very serious chronic cases would actually be supported and managed from the community. But again, because we have not yet reached there, those people have to be in hospital. That is my closing remark.
Wow. I oh my gosh, like I'm blown away. I agree with you 500%. And I love especially your last remarks that, some patients, in fact, many patients who are in hospitals with the proper care and support at home, they don't have to be there. But what I'm getting with, these conversations that we are having is what Judy is talking about, lack of a support system. And I'm just thinking it's because we are not aware. We are not aware that maybe if I give the people around me just, quality attention, if I listened to them, if I just observe them, I'd be able to pick up very fast that so-and-so is not okay. They must be going through a rough patch. And then if someone is going through a rough patch, I, as a friend, as family, how can I come in and support them? I think that, oh my goodness, that for me, that was my biggest takeaway. And we have come to an end of this session. My God, we can have this discussion for the next 3 hours. I am loving this discussion. Thank you so much. Thank you. You are a wealth of information, and you're a very good lecturer, so to speak. And the reason I'm saying that is because you're able to break down very complex subjects or very complex topics to something that as a layman, I can be able to understand. I now have a very good understanding of what anxiety is, of what depression is, and just understand, okay, just because I'm disappointed today does not necessarily mean that I'm depressed. But ikiendelea over a period of time, and I start, acting like this, I start getting this, then I know perhaps before hata niende nifanye, let me just speak to someone and just, try and make sense of things. So thank you for your time. I honor you for being here. Thank you for sharing your wealth of knowledge. Thank you for answering, our questions in a way that I think even my 10-year-old can be able to follow this meeting and really get something, which for me is amazing. We always say, Alex saying, you know what, if you want to sound very educated, make it complex. If you want people to understand, make it as simple as possible. And for me, that is what you have done. You've made it as simple as possible, and you've made us understand, so much about subjects that really we didn't have so much knowledge on. So thank you so much. God bless you. Thank you for your time. Thank you guys for tuning in. Thank you for your feedback. Thank you for your comments, and have a lovely weekend. And yes, as we have said, please let's be a support system for each other, because as the Reverend has said, you never know, itakuwa mimi kesho, itakuwa wewe kesho, we don't know. So let's support each other in this, and let's end the stigma. That's it, guys, and thank you so much. Have a nice weekend, and we can see Kiri wants to say.
Thank you. Thank you. My time has come to conclude it.
We honor, is it a her? We honor her for
Him.
him. What's his name?
Mushu.
Oh, we honor him for
Mushu.
coming to conclude with us. Thank you. So thank you so much.
Thank you.